So, like Annie said, I am Courtney Kowalchuk. I am a psychotherapist. I'm going to be presenting on sleep hygiene with adolescents, in particular with adolescents today. And yeah, I'm really excited to be here and to get to chat with you guys about this tonight. So, welcome everybody. Thank you so much for attending. We will have a little brief survey at the very end. Annie will throw it in the chat so that we can kind of get any feedback from you guys about how helpful this session was and kind of what you guys are interested in maybe adding or taking away or what was good or what wasn't. So keep your eyes out for that. Also, Annie will share the PDF version of my presentation in the chat as well. Yeah, just for like a little bit of the housekeeping stuff, I just want to say I like to have dialogue in these classes. It kind of makes for a more interesting and kind of engaging presentation. If you don't feel comfortable talking on your mic or on your camera, you can just put it in the chat. I do frequently look at that just to make sure I'm answering questions and hoping to get some engagement there. I think that's it. The material's recorded and you'll be able to access that like Annie said. If you have any questions or comments, concerns, throw them in the chat. Otherwise, here we go. Okay. So I typically like to start either with a quotation and a discussion or just a discussion like today. I'll be honest with you, I couldn't really find any really great quotes about sleeping or anything that was really getting a reaction out of me, or so I skipped the quotation today. And I just have a question for you parents, and I just want to know, again, by way of the chat or raising your hand or just kind of starting to speak, you can unmute yourself. Let me know, how well currently are your kids sleeping? We'll just kind of jump in with that question. Does anyone feel like their kids are sleeping really well, getting, good rest, restorative rest? Does anyone feel like their kids are never sleeping? There's a problem with sleep? Very bad at sleeping. Okay. We've got very bad. I'm curious to know more about what very bad means, but I'll take it if that's all I can get. Oh, stays up very late. Okay. Thank you. Oh, we're getting some stuff in the chat. Marco says, okay, my kid goes to bed around 10. Difficult to wake up. Okay. Bad at sleeping early. Sleep well, except on the nights that we have soccer practice that ends at 9. Oh, yeah. My younger kids maintain pretty good sleep patterns. So maybe the older ones, Trisha says, maybe the older ones don't. Oh, sleepy during class. Okay. So not sleeping very well, hard to wake up, sleepy during school. 3-year-old does not sleep in her bed. 10 and 13-year-old sleep well. Okay. Yeah, and so man, I'm gonna try, like I always do, to put as much information into this, hour and 45, 2 hours as I can. That being said, to cover the range from 0 to 18 is like an incredible feat for just information in general when it comes to parenting. So I'm going to do my best to tackle all the questions or all the kind of scenarios, like I said, from 0 to 18. But what I've got is a great presentation with a lot of evidence-based back information about sleep when it comes to children and adolescents. I will say sleep does vary by age when we talk about children, right? Especially just with the importance of like physiological and biological changes, psychological changes, psychosocial changes. So that's kind of a big deal. So I'm going to do my best to tackle that. Liz says 12-year-old sleeps almost 10 p.m., wakes up at 7:30. Wait a minute. I'm confused. Oh, okay. 10 p.m. and wakes up at 7:30 a.m. Oh, wakes up in a bad mood. Oh no. That stinks. Time management between activities. You want kids involved when they need to get up and be effective at school doesn't go well together. Totally. I hear that. We'll talk a little bit about that, right? There's definitely an impact between as kids age, right? And more activities and sleep. 7-year-old always wakes up in a bad mood. Hard for her to want to go to school happy. Oh, Kelly says 7-year-old is not very happy when going to school. I guess not too uncommon either, but I guess I can imagine. I kind of tend to always, when I'm talking about kids, I always try to do a parallel of adults, right? So I say like, man, well, I know a lot of adults who go to work in bad moods or they wake up and they're like, oh, off to work again. So I don't know. I try to remind myself, like, even though, well, they're young and, we sometimes have these different expectations of them. And yet that's always a parallel for me of like, man, sometimes I go to, I go to work in a bad mood or maybe unhappy, but if it's all the time, maybe there's some tactics. Maybe she's really tired and we can come up with some tactics to help those kids that are waking up in bad moods and at least get some information as to why that might be the case. Man, great feedback, you guys. Thank you so much. That was a decent amount of feedback. But what I'm hearing is some sleeping really well, some sleeping well with the exceptions of like activities kind of getting in the way, some not so good at sleeping and staying up too late. Lots of like they stay up too late, they're not easy to wake up, or they're in a bad mood, things like that. Okay. Again, thank you guys so much for the feedback. It's so helpful. What I will say, and this is just to kind of get the discussion going in terms of sleep. I will say that sleep for children and maybe sleep for adults is one of the most talked about things in my practice and in my work. There is a wealth of evidence that suggests that adolescents are chronically sleep deprived. And this is like kind of across the board nowadays. I think particularly this gets worse post-puberty, right? So older kids, teenagers, this is very geared towards them. And yet, in my experience, so this is kind of some anecdotal evidence as well as empirical evidence. There is a huge issue. Some people are calling it an epidemic when it comes to adolescence and sleep. And so in the last couple of years, I have not done this talk on sleep. This is a new addition for this year, just because of all this research and all this data. And with parent concern, I've added this topic of what I call sleep hygiene. For a lot of people, they're like, what? That sounds so weird. And the reality is, sleep hygiene is a term that medical professionals and therapists we use. Maybe some of you guys have heard it before. If you have, let me know in the chat. we utilize this term to talk about healthy sleep patterns, right? Or healthy sleep habits. And so that's really all sleep hygiene means. Yeah, totally. So Cality says, just like you take care of hygiene, you take care of your sleep too. 100%. That's why we call it that. It's more of a lifestyle practice that we want people to take care of and look after, because it's not just as simple as hitting the bed, going to sleep, and waking up. I'm sure most of you adults can relate. You remember, maybe fresh in your mind, the sleep deprivation when you had very young children, if your babies are not young anymore or not babies anymore. It is a very important, crucial part of the human experience. So we want people to look at this as hygiene. It's a lifestyle change. It's a habit that we want people to look after and change. So Cality, you are absolutely right. I hope I'm saying your name right. I'm pretty bad with names sometimes. So the objectives for tonight, yay. This is on the flyer that you get. I'm going to just quickly hit these. And so we kind of can talk a little bit about what we're going to talk about tonight. We're going to identify how sleep is your child's foundation for health and learning. It's incredibly important when we talk about human development to talk about sleep. And it really is the foundation for learning and academic consolidation in the brain. Today, I hope to educate you guys on how sleep impacts their brain development. So if they're in a deprivation versus surplus or maintenance state, I want to talk to you guys about how that's going to impact not only their brain development, but their brain function. I want you guys to learn ways to improve sleep for your children. Of course, I can't just come at you with all this information and facts and data and then not give you some tips. And I want you to be able to get some answers regarding your child's specific sleep issues. I try to allot time at the end for questions, and yet right now we're at like 30, 35 participants. We might have enough time during the conversation for me to just answer questions. So if you've got them and you want to brave the waters and get vulnerable, ask away. I really try to answer your specific questions, because I realize I can't hit all the points and do everything in a 2-hour conversation. So I also lastly want to help you gain understanding on how to set your child up with solid sleep hygiene. So that's like the takeaway. I want you to be able to go back to your kids and be like, here's some actionable steps that we can take and information that you can provide them, right? Especially like as your kids get older, constantly giving them the information so that they can be more independent. That's kind of an umbrella goal of mine. How can we raise successful, well-adjusted, happy adults, right? So some of these tips you're going to be able to use for yourself if you don't have the greatest sleep hygiene. My hope is that you can use this stuff as well. It's going to be applicable. Yes. I'm I'm not going to be good at that name. Ferozan says it's not just the sleep, it's all about having good, restful sleep to recharge for the next day. 100%, you're ahead of the game. That's one of my points. Totally accurate. And thank you so much for sharing that. It's really about that like restorative recharge, because we're stressed, we're humans, our kids are stressed. There's a lot going on. There's a lot of expectation and demand, and sleep is how we restore. And that's a really important kind of beautiful thing that, as crazy as the day is, we get this little time biologically built in to help us restore. There is a copy of the presentation in the chat. Annie just put that in there as well. So here's our objectives for the evening. We're going to go ahead and keep moving along. Okay. How much sleep? This is probably a question that a lot of people ask me, a lot of parents have. The answer to this is that it does vary by age, and there are also small variations in individuals. So this might mean some of these averages that I'm going to give you, there's also a breadth to these. You're going to have to individualize this to your own children, right? And you might know from the time they were little, they needed a little bit less sleep or they needed a little bit more sleep. And you might not. So if we're talking infants, 0 to 3 months, they need tons of sleep between 14 and this says 17, even anywhere between like 13 and 18 hours of sleep. Once babies hit like the 4-month-old mark, they're going to kind of reduce between 1 and 2 hours every couple of months. And yet babies and toddlers up to 2 years still need between 11 and 14 hours. You'll find that toddlers, they kind of, again, reduce a little bit. But the average for kids is about 12 hours until they hit like elementary school and school age. And this reduces down to 8 to 10 hours. And so this is saying from school age through the teenage years, kids need 8 to 10 hours of sleep. The research shows us that 9 is the magic number when it comes to peak mental health performance and benefit. So we'll get a little bit more in depth with that. But the reality is that you want to really shoot for 8 to 10 with your children. I would say if we're talking kids who do like a lot of sports or extracurricular stuff, or they're busy or they work, or like you might even find that they need 10 or 11 hours of sleep, and that's fairly normal. Does anyone have questions about the magic number or like any of these points in terms of like how many hours your children need?
Yeah, why would be 9 the ideal number, like the magic number? What's the reason behind it?
Oh, thanks, Raphael, for the question. So my only answer for that is that's what the data shows. They study children who are getting under 7 hours of sleep, because we're going to go a little bit more into detail, and yet kids who get less than 7 hours of sleep, 7 to 7.5 hours, they start to see a decline in mental health functioning. They see an increase in things like anxiety and depression. It even gets worse as bedtimes get later. And like I said, I'll go into that, some more of the like, why is that the magic number? But the reality is what we understand is that the human system, particularly children, that's what works. That's what the data is showing when they hook them up, to the different types of sleep assessment machines. And then the following days, weeks, months, years, they're finding that the best performance for kids is resulted from 9 hours of sleep. And so again, you're going to hear more of the, I guess, bulk of specifics and particularly as it relates to mental health, because of course that's my field and my specialty, but 9 hours seems to be what human beings need in those age ranges. Cool. I hope that answers it. Any other questions? Thank you. I love questions. If not, we'll keep moving. You can throw things in the chat if you'd like. Okay, so I think when it comes to adults, I'm just going to throw this in here. There's so many different studies about sleep deprivation in adults as well, and how our cognitive function declines with a drastic measure if we even miss a couple of hours of sleep. Like if you're clocking like 6 hours of sleep a night, the equivalent is it's like drinking a couple of cocktails or a couple of beers. It's really quite fascinating, sleep. But cognitively, if you're not getting like 8, and for adults, the recommendation is 8, right? 8 hours of sleep. And yet I know a lot of people that don't get that, a lot of adults that don't get that. So I just want to throw that in there. I know that this is not particularly about adults, but you're adults and you guys are all parents. So if you're not getting 8 hours of sleep, some of this is going to be relevant to you as well in terms of impact. All right. I hope that most, if not all of you, are getting 8 hours of sleep. All right. So some kind of conversation starters. 25 to 50% of children and adolescents experience some sort of sleep issue during childhood or adolescence. That's a lot of kids. Half, 50%. This is a big range. Obviously, things are reported, underreported, parents are reporting it. So there's kind of a big range, but the reality is up to 50% of kids experience sleep issues during childhood or adolescence. I am kind of in the thick of newborn and then infant. I have a young one that was born recently, so I'm working kind of in this sleep deprivation and sleep training mode, which is kind of interesting that I'm doing this right now. But yeah, I think that kids from a very young age, we lay this foundation or platform for sleep, and the reality is, like, it sounds like things kind of throw a wrench in those sleep plans a lot of times. And I don't know if you guys can relate to that, whether you think maybe your child is one of the 50%. And if your child is, you could throw some of the particular sleep issues that they've got, or, again, questions that you may have. The reason that I wanted to bring this topic up and share this with you guys is because sleep deprivation is pretty serious. And so I'll go over some of the issues and causes, the outcomes of sleep deprivation. And obviously we talked a little bit about this when I just said that adults that are sleep deprived function as if they were intoxicated, slightly intoxicated, right? The research is kind of showing that the cognitive function takes a similar type of hit. And so sleep deprivation can cause cognitive impairment. So we're talking about reduced attention, memory, and decision making, right? So that prefrontal cortex type activity the executive functioning type activity, the secretary of the brain activity, and think about kids who we've already got this underdeveloped, or maybe not underdeveloped, developing part of the brain that the prefrontal cortex doesn't fully develop until 25, right? And then we have cognitive impairment that's further reducing that executive function in the brain based on sleep deprivation. So to me, it's like a double hit, right? McCartney says he has trouble falling asleep even if he's tired. Okay, yeah. And so my curiosity is like, how old is he? Kind of what are some of the habits around sleep? Maybe if you can feel free to answer that, maybe if you're interested after I go over some of the presentation, if you've still got questions about what's going on, why he can't fall asleep. Because to me, that's like, we would refer to that as like some initial insomnia, right? People who have trouble falling asleep initially. Obviously, I'm not diagnosing your child. I've never seen them or assessed or evaluated, but off the top of my head and just for conversation purposes, that initial issue falling asleep is very common. And there's some things that are going to be in the presentation that can help with that. And so my hope is once you make some of those small changes or some of those tweaks in your child's routine or in their external environment, we can improve that initial insomnia and help them be better sleepers. Okay, sleep deprivation can also cause mood disturbances. So I talked about this, that 9-hour magic number. They found that kids that were getting less than that had increased risk of anxiety and depression. I'm going to get even further into this when we talk about suicidal ideation, suicidal attempts, things like that, much more serious issues. That's when we talk about even more extreme sleep deprivation. So like getting much less than 7 hours of sleep, having a bedtime later than midnight. We'll kind of run through some of that stuff. But at the very least, sleep deprivation causes mood disturbances. If you guys remember when your babies were young and you weren't sleeping because they were crying and they needed you, there's certainly some parental mood disturbance there. No shame in admitting that. There's also a lot of evidence to suggest that when babies get sleep trained, the maternal life satisfaction goes through the roof, right? So helping our babies get good nights of rest actually totally promotes postpartum well-being and maternal health. AM says 12-year-olds tired all the time, regardless of whether it's 8 or 13 hours of sleep, actually gets more hyper the more tired he gets, which complicates the process of actually falling asleep. Totally. That's not uncommon for kids to get those bursts of energy if they're overtired, right? And so there could be, like, I would also say, I'm always going to recommend people go to their pediatrician and get any medical things ruled out, right? Because you want to make sure that there's not something else influencing sleep. There's things like reflux, restless leg syndrome, like all kinds of sensory disorders or mental health disorders. There's all kinds of stuff that can affect that. And yet there's also medical thyroid issues, things like that can affect their sleep. And so I would say definitely that's a good kind of first stop is like pediatrician. What do they think? And the other reality is like, what's their sleep hygiene like? What's their bedtime routine like? Do they take naps? We're going to kind of really tease out all that stuff. And so totally not uncommon for kids to get hyper as they're overtired. If a kid is tired all the time, do they have a sedentary lifestyle? Are they looking at a lot of screens? What's their nutrition like? Are they napping? What's the routine and schedule like? Those are kind of some of the questions that I'm going to ask and the things that I'm going to go into. So I hope that helps a little bit. And then, of course, like I said, if you still have questions after we get through the bulk of the presentation, I'm all for answering those for you guys. Physical health problems, we find that sleep deprivation is correlated with things like heart disease, diabetes, obesity, cardiovascular disease, like I mentioned. There's a lot of physical health problems that stem from sleep deprivation. And with these kinds of health issues on the rise and sleep deprivation apparently on the rise, we want to do whatever we can to wrangle that back in and reduce any of the risk factors or kind of comorbid diseases or medical problems that kids may have. And so not getting enough sleep for kids is certainly able to and does impact their physical health. So also, when we talk about a little bit about older kids, there's a lot of issue with kids who drive and who are sleep deprived. That becomes more of an issue. They're not as able, again, to pay attention, to react to what's going on in their external environment. Okay, so in therapy, I talk to people a lot, especially when they first come to me. I ask them about sleep, and it's really kind of critical to help my clients and their families and kids recognize that sleep is the foundation. One of the parents already said this. They shared that it's not just about sleep, but it's about that restorative, healthy, restful sleep that kind of recharges you for the next day. And so when we talk about sleep from this medical lens or this psychological lens, we're literally saying that there are 4 critical functions to sleep, and they're all equally important. And so, like I said, the critical functions, there's 4 of them. 9 to 10 hours is typically recommended. You're going to kind of have to look at your child on an individual basis and see, do they need more like 9? Do they need more like 11? And kind of vary there. But like I said, 9 typically is good. If you have a child that's like, okay, they're sleeping 8 hours one night and 13 the next, 10, 5, get them on a schedule where they're sleeping 9 hours every day for a consistent, consolidated amount of time and kind of see what they need. Do they need a little bit more? Do they need a little bit less? The reality is, when you have this inconsistency in how many hours they're sleeping, you can't get a good picture of what your child needs individually. And so we really want to get them on a set routine, and kind of that way it gives us, that evidence to say and rule things out and say, hey, this really seems to work, or this is kind of the small tweak we need to make for our own individual child. But getting back to those 4 critical functions, the first of which is restoration, right? For those of you that go to the gym or exercise or are athletes, or you have been in the past, the top thing that everybody says is like, take a rest day, right? It's restorative. It repairs any tissue and muscle damage. It promotes cell turnover when we're sleeping. It promotes immune function. That all kind of resets as we sleep. That's why all the doctors like, go sleep, go home. If you're sick, go home and go to sleep, right? You need to restore positive functioning immunology, and then we also need to repair tissue and muscle. Any breaks, sprains, anything like that, sicknesses, illnesses, you'll find your kids need more sleep, because that's what's happening. The biological system or the physiological system is that It is repairing itself as we sleep. If we don't sleep, you're going to notice aging happens, cell aging happens faster. And that affects everything, right? So you'll notice just this general kind of decline in a lot of maybe physical manifestations of that, but you'll notice, oh, I'm achy, or I'm sore, things are physically feeling worse. I know a lot of people that get sick very often when they're sleep deprived. So I have a lot of friends or colleagues or people who say, oh my gosh, my family's been so sick. It's just sickness after sickness, and they're just sick a lot. And so I'll often kind of assess for sleep and say, like, how, what's the sleep pattern like at your house? Is everyone kind of sleep deprived? And if we can kind of manage without excluding all other things, right? Practically, there's probably more to the issue, but at the very same time, having good sleep allows for this physical, biological, physiological restoration that is crucial and happens when we sleep. The other really big one, and this is particularly relevant to mental health, to the psychological aspect of things, and that is, and learning, academics, this is memory consolidation. And I don't know, this is kind of becoming more popular now. There's a therapy treatment called EMDR, eye movement desensitization reprocessing therapy. If any of you guys have heard of EMDR, it's one of the gold standard treatments for trauma. I am trained and certified in EMDR. Not a lot of therapists are, and yet it's a fantastic treatment. It's evidence-based. Like I said, it's the gold standard for a lot of large, empirical evidence-based organizations for the treatment of trauma specifically, and then now it's substance abuse, anxiety, depression. It's expanding. Its uses are drastically expanding. But the reality is that is memory consolidation, and they utilize memory consolidation in order to reprocess traumatic memory. And so the interesting thing is memory consolidation happens normally during sleep. You might notice if you've seen movies or you see a friend or a spouse or somebody sleeping, kids, their eyes will twitch, right? You might see like it's fluttering under there. You might see movement. That is that memory consolidation. And their eyes are moving in a left-right pattern in a really fast manner. That's how our brain is consolidating memory. It's organizing and consolidating memories to put them in kind of neat little boxes, right? And it promotes really healthy mental health functioning. And so this is kind of what we do in EMDR is we manually go in and we help people consolidate painful and traumatic memories that are not stored properly. So very cool. We've kind of done the research and found out that's what's happening when people are sleeping. And it's incredibly, incredibly important for the academic function for kids. It's going to be incredibly important for the mental health of all of us, right? Because if we have properly organized and consolidated memories, we can then recall those in a really appropriate way instead of a like maladaptive or dysfunctional type of way. Emotional regulation, this is huge when it comes to mental health, right? We're talking about emotional stabilization and stress reduction for our kids, us too, but our ability to regulate our own emotions, our kids to regulate their emotions when something happens that they don't like or something hard in life, right? Help reduce the cortisol levels in the brain. This is all so crucial to their functioning, both at school, in their family life, in their work life, if they work. Emotional regulation is one of the biggest, I think, needs for kids. And this is one of the primary ways that emotional regulation is both occurring and maintained in the brain is by sleep. Physical health, we talked a little bit about this already. I talked about cardiovascular disease. I talked about like links to diabetes. links to weight issues and obesity. Talked a little bit, we didn't actually talk about hormonal imbalances. This can cause hormonal imbalances and lead to thyroid conditions or other endocrine system issues. We also talk a lot about metabolism, and metabolism is kind of that precursor to the weight stuff. And if we've got good sleep, your body's more able to metabolize correctly and properly. If you're not getting good sleep, this means obviously more challenged metabolic function. And I think with the addition of a lot of the other metabolic disruptors in our lives, right? The food we eat, the stuff we consume, the things in our external environment, metabolic health is becoming a lot more important because, like I said, it's kind of a precursor to these other things like weight issues, diabetes, that sort of thing, things that are kind of linked with that. So this is kind of helping everybody understand these are the critical functions for sleep. This is what's going to be impacted greatly if your children are not getting good sleep. Okay. So we're going to kind of jump into this conversation of adolescent brain development, and without getting too far off into the science behind it all, what we look at is the amount, the quality, and the consistency of your child's sleep. So how many hours are they getting? And you could kind of do like a quick assessment of this, whether you want to write it down or you want to do it in your head. How many hours a night are your children getting? What's the quality of sleep? Is it interrupted sleep? Are there a lot of wake ups? Where are they sleeping? How do they seem when they wake up? Are they telling you that it's very disrupted? So looking at the quality. Sometimes parents, you might check with the pediatrician if they're not getting good sleep, and they might even recommend like a sleep study, and you might even be able to get some quantifiable data of the quality of their sleep, right? I'll kind of get a little bit into that later. The consistency, again, is that third part of this conversation. How consistent is their sleep? And when we talk about kids, we really tend to highlight and prioritize consistency, not over the amount and the quality, obviously, but it's very important that it's consistent sleep. Okay. And so the regions of the brain that are crucial for, like I said, self-control, learning consolidation, reward processing. So all of the things that enable kids to behave in a way that's socially acceptable or socially useful. We talked a little bit about that in the positive discipline class, these like socially useful behaviors, right? Where we expect them to be in control and sitting in class and listening and learning and retaining and, comprehending the knowledge, doing their homework, coming home, behaving with their siblings, right? Managing their emotions, regulating their emotions when they're upset, getting good grades. These are kind of all the functions that are really centered in this prefrontal cortex region. There's direct brain functioning impact with poor sleep quality, poor sleep consistency, and poor amount of sleep. This really, put simply, is going to lower academic achievement in school. We're talking grade school, elementary school. We're talking all the way through middle school. This goes up to high school and even college, right? So lack of sleep is going to directly impact and lower academic performance in school. This can be said of adults, right? The parallel to that is our performance in the workplace setting or in the employment or career setting is also very closely tied with sleep. I'm sure, as you guys can anecdotally say, right? Oh, I didn't get good sleep and my whole week is like, I'm not productive or I'm not doing well. I can certainly say that. Not as productive, not as um, on it, so to speak. So again, this goes back to the amount, the quality, and the consistency of their sleep. If you can kind of check in with those three things for your child, that's a good starting place. The reality, when it comes to brain development in children, the reality is that there is a biological sleep delay that happens during puberty. Okay. So you might even say, oh my gosh, my kid was such a good sleeper. All of a sudden they hit puberty and now they're not sleeping well. This is not abnormal by any means. I should say it's not uncommon by any means. This is normal developmentally for there to be a sleep delay in puberty. It's a biological function. We could theorize why this happens. I don't really think the why is important. I think the important part is that this does happen. What happens with this sleep delay, right? What we're calling is that it essentially resets the circadian rhythm for your child, and it leads to this more night owl, quote unquote, sleep pattern. It biologically makes it more difficult for adolescents to fall asleep before 10 or 11 p.m. Okay. And so this became part of the reason why a lot of schools started later school times. There was this shift to like start later, right? Because there's all this data that's suggesting that there is this biological or physiological sleep delay. And this coupled with earlier school start times, it's converging, right? It's causing shorter sleep duration than what was happening pre-puberty. And the great thing is that some of the schools listened. They heard this. They're starting a little later. And this, in my opinion, as a therapist, is why. And it's incredibly beneficial for society and culture to look at this and say, we're kind of setting kids up for failure if we recognize that post-adolescence, there's this onset of a sleep delay. It's harder for them to fall asleep biologically. We're not just making this up, right? This happens physiologically in their bodies. And they kind of adopt this more night owl model. I don't know if that's because biologically and instinctually that they were kind of being prepared to go hunt and gather or whatever, and they needed to be able to be up longer in the day. There's probably some theories. I'm not going to go into all of that. Could be really interesting rabbit hole if you're interested in that. But the reality is that this causes shorter sleep duration, essentially sleep deprivation for kids. Okay. So a lot of schools kind of were adopting that. I don't know, Annie, I don't know if you have any info on how many schools in the district for San Marcos have a later start time. Do you know?
Um,
Just like
for like
ballpark.
for middle schools, they all start, I believe, closer to 8.
Okay.
And high school starts now at 8:30, which before used to be before 8. Um, and then our K through 8 schools, they do stay on the earlier schedule with the whole school since it's a K through 8 school.
Gotcha. And so, yeah, thanks for that, Annie. I know I kind of put you on the spot. That makes a lot of sense, right? Because you have younger kids, they haven't hit puberty yet, and most of them or some of them, right? This kind of like prepubescent stage. And so they haven't hit that biological circadian rhythm upset, we'll call it. And so, yeah, maybe, the older kids, the schools, they've kind of adopted some of that. So, Natalie says, The middle school does start at 8. It's hard for my 11-year-old to get up and get there on time. Yeah. So the 11-year-old might kind of be on the cusp or kind of experiencing some of this. And my hope for you guys is like, you can take this information and you could even share it with your kids, right? Or you can take this back to your spouse or your partner or your co-parent or whoever, right? And it's like, look, like this is why, and this can help you. This just kind of understanding that like, oh, this is what's happening. Like there's not anything wrong with me. And like, yet here's how I can handle this. Here's how we can work with this, right? I think that hopefully is a really cool thing that you guys can take from this today. The other piece of this is that external factors are going to further complicate this sleep delay, right? So we're talking about adolescents, their brain has a higher sensitivity to blue light. The research is finding, for whatever reason, their brains are more sensitive to the blue light from screens, phones, iPads, computers, TVs. So if your child has any of those in their room at night, this is going to further complicate that sleep delay. Okay. If you, yeah, I was going to say, if you've got just everybody check your mics and make sure that they're muted. I don't want anybody to feel embarrassed or have to deal with everyone hearing your business, but it's also okay. We understand. Okay. So like I said, external factors, TVs, computers, screens, iPads, phones, we're going to get to that. There's another conversation that we're going to have. I think it's the last class. I think it's the 29th of May, where we're going to talk about specifically technology and social media. However, for me to very simplify that conversation for the sake of time and for the sake of our conversation staying on topic, the adolescent brain is more sensitive to blue light that comes from screens, and that will further complicate the sleep delay that happens after puberty. So you could do with that nugget of information what you will. My recommendation as a therapist with this information in mind is that you don't have blue light in their bedrooms, and you certainly turn it off at least 2 hours before bedtime. That might be like a charged statement, but I'm ready for it. Okay. This is what the data is telling us. This goes for us too. I mean, we're not, again, adults don't have that added sensitivity like the adolescent brain does. And yet it keeps us up too. I'm sure if you guys do an experiment where you turn off your phones and you don't scroll, or you don't have your TV on or your phone or your laptop or your iPad 2 hours before you go to bed, and maybe you read a book, not on a pad or a whatever they call a Kindle, like you read a real book. Try that for 2 weeks and see if you don't sleep better. Barring medical issues, blue light. So yes, for the sake of today's conversation, McCartney, blue light includes TV. Yes. So one of the other things that greatly impacts sleep when we're talking about, that greatly impacts brain development when we're talking about the conversation of sleep, psychosocial factors. These are very impactful on sleep, right? This leads to cognitive decline. We're talking about socializing. So any of those psychosocial factors are things like socializing, talking on the phone, texting with friends, being on social media, any of that like social connection that's happening at night. We also know that studying, right, some of those things, the demands, doing activities late at night, if your kid is a kid who maybe procrastinates and waits until the wee hours of the night to study hard for a test or to complete a project, we do see that the data suggests that that's actually more harmful than not studying, staying up late into the night and doing that. You could kind of do some research on that if you're interested in it. And yet what we know is that these things also show there's an increase in what we call intermittent waking. When we have screen time and socializing, studying late into the night, right? Internet and phone use, messaging back and forth, doing FaceTimes, Snapchat, I know is really popular. Not only does that lead to this like cognitive function decline because of quality of sleep and all of that, it also suggests that when they fall asleep, there's more waking in the night. There were some studies done, some kids that were using social media at night, they did some brain scans while and some they hooked them up to all the kind of sleep apnea type machines, sleep assessment type machines, and some of them were waking up to 22 times in the night. And this obviously was a greatly increased population when it came to kids who use social media versus kids who don't. And so that was kind of fascinating as well. We saw that it increased intermittent wake. So it wasn't just like, okay, your kid's it's gonna affect them and their ability to fall asleep. It's also gonna make them wake up more. Okay, so they're gonna have more interrupted or disturbed sleep, which we know is damaging because they're not hitting all those REM cycles and all that kind of stuff. So here's some of the research that I wanted to share with you guys, just so you guys are kind of cognizant. I'm not just making this stuff up. Here are some of the studies. You can find this stuff on like Google Scholar and things like that. Again, like empirical evidence that's telling us that the insufficient sleep is associated with like alterations in neural functioning. So we talk about like those neural connections, right? Which is kind of the foundation of brain function. And so basically they're saying lower cognitive control, lower prefrontal cortex activation, and lower white matter integrity, meaning we see structural change, structural impact to the brain with sleep or insufficient sleep or sleep deprivation. So that's a big deal. When we talk about structural change to the brain, we're also, we talked a little bit about this when we talked about trauma. And so sleep can do this too. And so shorter self-reported sleep duration, this actually correlates with higher stress and greater risk-taking when under stress. They were finding, I'm going to say, go ahead and, I don't know, I think somebody's mic kind of keeps getting turned back on. The reality is that those variations in sleep and decreased sleep led to issues with the reward processing system in the brain. I mentioned this a little bit previously. And essentially what that means is we're going to have an issue with behavior, right? The reward processing center of the brain has everything to do with behavior. Excuse me. And so if you're finding there's a lot of behavioral issues with your children, you might correlate this with sleep. And so getting another maybe assessment with the pediatrician or things like that, you can kind of, this would be a red flag to look out for, those behavioral issues, meaning those are linked with the reward processing area of the brain. Okay, so there's the research. We've got a lot of empirical evidence that suggests a lot of these things there, that states a lot of these things. We've kind of gone over some of these. The things that impact their sleep the most is biology. We talked about that, right? With this like pre and post-pubescent sleep onset delay. We talked a little bit, we haven't talked about families at all. Okay, so this was one of the points that I found kind of the most interesting. I've worked with most kids that I work with, obviously have some sort of mental health diagnosis. Many of them have had suicidal ideation or suicide attempts or self-harm behavior. And what we found was bedtimes that were set by parents that were earlier than 10 p.m., there was a 25% lower chance of depression and anxiety in that population. Families that had, and this was where I was talking about families that had bedtimes that were later than midnight, or with kids that were getting less than 7 to 7.5 hours of sleep, those kids were at a higher risk of, I think it was between 30 and 40% higher risk of having suicidal ideation, suicidal attempts, or self-injurious behavior, self-harm behavior. And so when we look at that, we're looking at, to me, that translates as like, it's incredibly important for families to have these routines and these parental imposed bedtimes, even into teenage years. So I know that that's not popular for most parents or most circles, and yet into teenage years, sharing some of the data with them, sharing some of the stuff with them as they get older might be really helpful, because you might have a teenager who's super resistant, especially if they don't have a bedtime right now, or their bedtime is really late, or they've got kind of full reign over devices in the middle of the night. This will be difficult, and yet at the same time, you might be able to get them on board if you share some of this information and kind of empower them with some of this information. And so again, bedtimes that are enforced by parents, parental regulated bedtimes that are earlier than 10 p.m. I will say there's kind of magic number for younger kids. The bedtimes are between 7 and 8 p.m. And as you get a little bit older, and then we talk more about number 4, which is school demands or after school activities, right? Somebody was mentioning that they have soccer until 9, right? I have a really good friend who's got great boundaries with sleep with her 2 girls. They're 11 and 13, and yet they're at dance until like almost 9 o'clock, 10 o'clock on Tuesdays. And so it makes sense, right? When we have school demands, so we'll just hit that point now. When you have start times that are earlier, when you have an increased burden of homework, we have extracurricular activities or after school activities that begin to increase, right? All of this kind of goes up after that puberty stage. That means there's more demand, and it coincides with that shrinking, like with that biological onset, right, of like later bedtime. So what we have to do is couple those and say, look, like this is going to wreak havoc on your sleep. And so we have to do a bedtime of, say, 9 p.m. or 8 p.m. You're going to have to figure this out for your family and what works for you guys. Believe me, this will be charged with families. And so, do your best with the information that I'm giving you, and yet know if you have a child that struggles with depression, anxiety, those types of things, having an earlier bedtime is shown to help. And at the very least, we have this correlation of increase in depression and anxiety with a later bedtime. So I did talk a little bit on the blue light. This wakes up your brain, right? We've all probably heard that. We know as adults, turn your devices off. It's really hard for us to do that because we're all kind of in a certain way addicted, I think, to our phones. Social media users. So these are kids that are using any types of social media. For the purpose of today, social media is any internet use. They're twice as likely to have disturbed sleep than non-social media users. So kids who use YouTube, Snapchat, TikTok, Instagram, Facebook, which is kind of most of what our kids are using anyway. If they're using internet, they're not like www. searching the dictionary, or right. They're most of them are using it in a social media context, which is kind of a more targeted use of the word. But essentially, this is the data. The blue light wakes up the brain. We talked about that. That includes TV, Kindles, iPads, phones, computers, all that stuff. And social media users are 2 times more likely to have sleep disturbance than not. So that's a big deal. In my mind, when we look at research, that's a big deal to be twice as likely for as simple as something like that. There's a little bit of talk about, there's some research done, probably not enough, on like racial disparity or ethnic disparities, where they did some research on Latinx or African American populations had more impacted or less sleep than white counterparts. This had some to do, there was some of the evidence was talking about longer commute times, kids maybe working more and having expectations to have jobs, right, because of income or things like that. And so there was some of that talked about, and that would be important to look into if that relates to you at all, and if you feel like that is something that could be happening. There's certainly some impact there. This is a very short slide. The answer is no for naps. A lot of people ask about naps. The reality, the very short, concise, brief statement that I can make is that research shows that naps disrupt nighttime sleep after age 5. So that's why usually you'll see those toddler age, they usually drop a nap anywhere around 3 to 5 years old. It's not typically recommended after 5. If they do have, maybe they have quiet time instead of a nap, right? They can go in their room and for an hour, maybe they play alone, or it kind of gives you a break. But the reality is that research shows directly, pretty conclusively, that naps will disrupt nighttime sleep. So this goes for adults, this goes for your kids. I think there's something to be said of like a really short cat nap. If you're like really struggling, like a 25-minute cat nap can sometimes be really productive. That kind of is individual based. So if you want to test that theory out, you can certainly do that. But I'm going to go ahead, since we're good on time, I'm going to pause and see if there are any questions that are arising after all of this conversation so far. Does anyone have any questions specific to the material that we've covered so far? Things that are coming up in your mind that you're like, hey, what about this? Or we can kind of pause for some questions. Annie, does that work?
Yeah, that's fine.
Okay.
You guys want to come off mute to ask your questions or drop them in the chat?
Yeah. And I want to say, I did want to verify, because there's all this talk about blue light, and some people are like, oh, there's no evidence backing that up, or like the blue light glasses, right? There's kind of some of this controversy, at least I've seen some controversy on that. There was a question asked about, does the blue light include TV? And yes, my answer that it includes TV is correct. The thing with blue light is it's essentially talking about the visible light spectrum, right? And so to avoid going down a wormhole there, it includes all of that stuff. And so it's essentially just what our eyeballs are kind of picking up, this frequency range. And so I wanted to just clarify and make sure that we were spot on with that. Okay, McCartney says, I was looking for strategies to more easily fall asleep and overcome the delayed sleep during puberty. Yeah, so that's kind of the last couple of slides is tips to both help your child and help yourself fall asleep. And so here's the thing. You can't really overcome, I'll say this, you can't overcome, so to speak, the sleep delay that happens during puberty, right? That's a biological process that's just going to happen. It's crucial for human development. It happens during that age range. Like I said, there's some theories on why, but essentially that's unstoppable, right? We can't fix that. And yet maybe overcome wasn't you trying to say, how do I stop it? It was like, how do we work with that? And for sure, what I will say is removing screens, right? Removing all that blue light. That's certainly, maybe we'll just go into that because that's kind of the only question that I see and that I'm hearing, and we're going to directly get you some strategies, McCartney. So, okay, what can we do? What I would recommend first is you're going to start keeping track of these sleep patterns and schedules, okay? If you're like, I have no idea how much my kids are sleeping, I don't like, where do I start? Start there. You're going to start keeping track of their sleep patterns and their schedules. And this means, you know, depending on your child, you're either going to observe them, you're going to supervise that, however that looks like for your family. You can ask them if they're older, hey, what time are you going to bed? Like, right? You're probably going to have to do some supervision. This might mean some loss of sleep for yourself initially to like observe, supervise, get this information. Some kids might wear Apple Watches or devices. There's all kinds of stuff like that you can get that track sleep patterns and track actually when they fall asleep and when they wake up, right? I'm not suggesting you use those. However, if you've already got one and you already use it, obviously that's going to be of massive help to help you with this sleep pattern schedule figuring out. But that's where you're going to start. And remember, I told you those 3 points, which were quality, consistency, and amount, right? And so I can go ahead and throw that in here because I didn't write it down right on this slide. It's going to be amount, quality, and consistency. So that's going to be part of your assessment, right? Of like the sleeping pattern. Oh my goodness. You're going to include this. So keeping track of that first, right? Like, okay, so maybe for like the next 2 weeks, you're going to have a little sleep journal or a sleep log, or you're going to have your kids kind of engage in that with you. And you're going to kind of start keeping track of that. And that is going to be obviously increasingly helpful. Justina, there's a copy of the slides if you scroll up in the chat. Also, Annie might be able to go ahead and throw it in there again. Somebody's asking about playing music in the room to fall asleep, not instrumental. My kids swear that they can't sleep without it. Well, I would just assess their sleep. Is their sleep good? Are they sleeping through the night? Do they wake feeling rested? It says not instrumental, so I'm assuming there's like some lyrics or something happening. I do find that most adults or that I speak to have kind of a variety of different sleep patterns, and maybe, you know, some people really like white noise, or some people like a fan, or some people, right? And we've got these kind of different patterns that we've developed. And so I would first assess, is the playing music in the room, is it showing you that there's some sort of disruption in their sleep? If not, I might be inclined to be like, okay, if you guys are getting great sleep, right? I would allow you to use your best judgment on that and just kind of see what you think. copy of the slides. Thanks, Annie. What type of time management suggestions do you have in order to squeeze in 9 to 10 hours of sleep for our kids? School, work, extracurricular activities, relaxation time. Bigger issue is time management. Interesting. Yeah. So I think that that's obviously going to be super case by case and individual or family specific. The reality is like you have to prioritize, right? So time management also includes priorities. What are the priorities for your family? Do your kids function well with 9 hours of sleep? I don't think the reality is for us to say like take away everything that they enjoy and don't let them play anything or have any time just so that they get their 9 hours of sleep. Because yeah, then we're talking about like quality of life, right? And yet when we talk about brain development and all this data that I gave you guys, there's really no wiggle room with that. And so you have to decide for your own family what the priorities are, right? And I think a lot of people saying like the kids' sports, they go until 9. Yeah, that's like pretty incredible. My push for that would be hopefully it's one night a week, right? I don't know how often, like I said, I have a really good friend who's also a therapist. We've known each other for years. Her girls are in dance and they go to sleep, man, it's late on Tuesdays, but it's Tuesdays, right? So that's another perhaps angle to look at is like how many extracurriculars are they involved with? Is this like a 4, 5, 6 nights a week kind of thing? Again, you have to use your best judgment as their parent, and yet my push for my kids, especially young kids, is going to be a push for the sleep, right? Because that affects everything. Whereas when we look at extracurricular activities and being involved in a sport, while it is totally beneficial, and I'm never going to encourage kids to not do that, we have to kind of weigh, right? The risks and the benefits and kind of what outweighs what. And I think one night a week is going to be okay, right? That would be okay for me as a parent. It might not be okay for some of you. And then you got to weigh that. And then I would say, making sure your kids have time, make sure they're using their time during the day to get their schoolwork in so they don't have to do it. I know some schools are kind of doing away with homework, which is probably a good thing. Right? Because of all of this research and data. And yeah, especially if they go to public school, this is a charged topic, a difficult topic. I have an issue with an elementary age kid, heavy sleeper who doesn't wake up. Oh, okay. I would look at if you have a child who's having a lot of accidents, I would look at a couple things. One thing would be check with the pediatrician. Is this a sudden change? Has it always been this way? The pediatrician might recommend that he wear kind of like a pull-up type thing. If there's some physical issue, he might have to rule out that. You would want to look at like kind of possibly like toilet training thing. Is it an issue with that? Some kids will hold it because they don't want to go. They don't want to get up and go. So there's kind of more to that, Sandra. I have an issue with a heavy sleeper. Oh, Annie just threw that in the message, I think. Okay. Pediatrician says it's going to fix with time, but he's elementary age now. So I would say go back to the pediatrician. Hey, it's not fixing with time. Is there some sort of medical thing? Can we rule out some of the medical causes that might be happening? I think one of your options is like you're gonna have to use some of these external things, maybe limit liquids, right? From like 6 p.m. on, he's not drinking any liquids to avoid it. You're going to kind of have to go back to that like kind of potty training type stuff. Alarm waking him up, no food or afternoon. He has to use big kid diaper. It's really an issue. Yeah. Happened after COVID. Okay. We already did all the tests. So this could be like, if it happened after a really stressful time, it could be like mental health related, right? So there could be some anxiety happening, or like he's avoiding going to the bathroom for something like that. That's probably going to be something that you might want to look into. Maybe if you've got some mental health benefits with your health insurance to use, or asking the pediatrician for a referral or something. So that's kind of what it sounds like to me. I would recommend asking either for a referral or getting that. Because that's a little bit more of a specialized issue. And that might not be an issue with sleep. It might be an issue with something else, right? I saw another question. Oh, you're very welcome. Okay, so some more tips, things that you can do. Maintaining a regular sleep schedule, right? So this goes back to the consistency piece. Your kids should be going to bed and waking up at around the same time every day, including non-school nights. So that means on the weekends. You're going to try to keep that difference in between sleep and wake times within an hour. And you really don't want to go past 9 a.m. If they're sleeping in a little bit, you don't want to push that past 9 a.m. I would say one of the biggest things is like being consistent on the weekends. And this is what a lot of like adults do too, right? Because they aren't getting very much sleep during the work week, and then they like sleep in, or their sleep is drastically flipped on the weekends because maybe they're staying up really late, hanging out with friends, or like playing video games or doing whatever. And the reality is that this is going to greatly reduce your body's circadian rhythm and ability to stick with a particular schedule. So it really needs to be stressed that it is consistent. Talks about like teens can stay up a little bit longer, right? I'm really not expecting you to have your teenagers go to bed at 7, although if I can manage it, my kids will have that bedtime for as long as I can manage it. Because that's their bedtime currently is 7. But I think there's a lot of benefits to that. Not only does the sleep research and data show us that a 7 to 8 bedtime is really good for young kids, it's really beneficial for parents, right? Because your kids go to bed and then you get some you time, you get some self-care time. And if you're in a spot, I just want to say I'm in a spot, right? Like I can relate. If you're in a spot that feels like it's never going to happen, if you do some of the kind of more gentle sleep training, or follow some of these sleep training tips or sleep tips, sleep hygiene tips, it does get better. It does. And there's some effort and maybe even some tears involved, and yet it can get better. So following some of this stuff and kind of getting them some consistency is going to be really helpful. Create a sleep-friendly physical environment. So we talk about comfortable bedding, right? You want comfortable bedding, soft pillows, or whatever your body really likes, something that's of good quality, something that, that works and keeps you warm or cool. You really want like that physical environment to be really good. The bedroom should be somewhat cool, right? If it's warmer than 75 degrees, it's going to be really hard to sleep. I know for a lot of people in California, we experience that during the summer, right? When we don't have air conditioner. Get a fan, get a little AC, something that can really make a difference in your sleep quality, can be so beneficial. You want it to be quiet, you want it to be dark. This goes back to like when you're sleep training kids, kind of the advice now is like white noise machine, blackout curtains. You want this really nice sleep friendly environment, because we want to make every effort to offset some of the struggles that come with sleep, right? So if we can control it, sleep environment is something that we can control to the best of our ability or to the best of our resource. We can try to create a sleep friendly physical environment, cool, quiet, dark. The other really big strategy for sleep is that the bed should only be used for sleeping. For kids, they shouldn't do their homework there. They shouldn't watch movies there. They shouldn't like listen to music and do things in their bed. This goes for adults. My recommendation when I get adults that come in is the bed should be used for sleeping or sex, and that's it. There really shouldn't be anything else happening in the bed, because you're creating associations in the brain. And that's really what it comes down to. If you use the bed for other things like scrolling and just laying there, or, reading, or, I read when I go to bed. The reading one for me has always been kind of iffy. I think it actually helps people fall asleep, but you could use a chair, right? You could read in the living room until you're extremely tired, or get a little chair in your room, your bedroom, and then you move to the bed, right? I read in my bed and it has never caused problems, but I read a real book, right? I'm reading, I don't use we don't use screens to read, but yeah, nothing else should happen in the bed except for sleep. And for kids, that's exclusively what we think should be happening in bed, right? Sleep only. Again, because this creates associations in the brain, then your brain goes, oh, well, I listen to music here, or maybe it's time to like read a book, or it's time to watch a movie. This isn't time for sleep, right? What we want to do is create, when I'm in my bed, I get tired, right? The melatonin starts going, your brain and your body will naturally create these associations with this spot. And that's evidence backed. So that's why we recommend that. And so again, try to really focus those other activities somewhere else, and then come to the bed when you're tired. Keeping a consistent bedtime routine. So like bedtime routine from the time they're really little can be really important. You might read a couple books with your kids. If you have older kids, you might just kind of like listen to really gentle music with them. They might have a skincare routine or some type of like wind down routine. You might do a meditation with them, or teach them mindfulness or a relaxation practice, right? To teach them to wind down, right? We're not like listening to music and watching TV and studying more, or using our computer, talking on the phone, exercising. So like try to initiate a bedtime routine with your kids. And that could be like you reading them a book or two, um, you know, or telling them a story, and again, that's younger kids, right? But like doing something that really helps you guys wind down versus amp back up. And a bedtime routine can be anything. It can be short, but as long as it's like the same every night. Maybe it's just like your kid goes in and puts on warm clothes to sleep in and brushes their teeth, and maybe kind of listens to a really calm song, or like whatever. I have a lot of like young girls that I work with, like middle school to high school age, that really get into like a skincare routine, and that's kind of like their bedtime routine. They get their pajamas on, they go wash their face, they put their moisturizer on, they put their, they brush their hair and they put it in a braid, or like something to like get your kids in this, like, this is my routine, I'm getting myself ready for bed. I take a shower or I take a bath, right? Something that like it winds you down. We talk a lot about like sleep issues with that like sedentary lifestyle that's more popular for kids now, which means like more screen time use, less exercise. I would say maybe even I could change this. Instead of saying incorporating exercise, incorporating movement of any kind is going to be really beneficial, right? Your kids are going to be working off that energy that they have. Okay. So maybe that looks like walks. daily walks. Maybe it looks like sports. Maybe it looks like 15 minutes, 20 minutes of bike riding or skateboarding or running around the backyard, or like some type of movement in their daily routine, some type of exercise. They could do yoga. They could do, you could teach them Pilates in the living room. Something to incorporate some type of exercise or movement is going to be incredibly helpful with getting that sleep tank full during the day. It's kind of a sleep tank, so to speak, and getting them ready for bed. Going outside, right? Sun exposure, it helps with the circadian rhythm. We talk a lot about sun exposure in the morning and getting your eyes to the horizon. If anybody's really interested and wants to kind of geek out on that, there's I'm not sure, a neuroscientist. I'm not sure what his specialty is right off the top of my head. His name is Dr. Andrew Huberman. He talks a lot about morning routines, healthy sun exposure, and how that equates to, good sleep and good health. He's a great person to listen to if you want to get more into this. Particularly, he's more adult focused, I think maybe exclusively, but talks a lot about like your circadian rhythm and how to get good sleep, and obviously how much this impacts the rest of your life, physical health, mental health. So maybe I'll go ahead and put his name here so anybody interested. He's got like YouTube videos and podcasts and things like that you could just listen to. So I really, really enjoy him in terms of like adult help, which definitely could cross over into the adolescent space if you are able to kind of generalize it and make it appropriate, age appropriate. Eating meals regularly, right? So not having kids go to bed on an empty stomach, obviously making sure they're getting enough nutrition throughout the day. This goes from like babyhood all the way through. But you definitely don't want to eat full meals like just an hour before bed, right? You want to have time for your body to digest, because what happens is when we sleep, right, some of that digestive function slows down. And that's kind of because obviously this other restoration, cell turnover, immune function, all that stuff is tissue and muscle repair is happening. And so the GI issues might happen if we're eating really big meals right before bed. So if maybe you have an early dinner with your family and then maybe you have a late sport, maybe have like a light snack before they go to bed, right? Something small, something not so heavy, like a rice cake, whatever, some fruit, something like that. Piece of toast. Obviously, when we talk about sleep, this is kind of probably more geared towards adults, right? But this goes for kids too. We want to avoid caffeine. I would avoid caffeine altogether if we're talking about children and adolescents. Obviously, alcohol, smoking, vaping, things like that. Sleeping pills or aids. I will say I have some like psychopharmacological background just because I've always worked with psychiatrists and worked with prescribers, and they will all tell you sleeping pills or sleeping aids are short-term solution for sleep problems. They are not good long-term solutions. Quite the opposite. If you're using this stuff or encouraging your children to use this stuff, it is not a good long-term option. So I would say go back to whoever is recommending those things and say, hey, I'm aware that this is not a good long-term solution. Like, what can I do instead outside of using some of this advice, right? These therapeutic type strategies. But we definitely say avoid all that kind of stuff. But again, this goes for adults, right? You don't want to consume caffeine after a certain part of the day. For everybody, that's different. Alcohol is you're gonna have less restorative sleep. They kind of have the research leads us to believe that when you use alcohol or drugs, you don't get the REM cycle stages of sleep that you need. So a lot of people, they might sleep really heavy if they drink or smoke marijuana, and then it turns out you're not getting the full REM cycle. So it's not as beneficial as you might think. All right, we're hitting like almost the 6:40 mark. I'm going to give you guys some takeaways and then I'll stop for questions if we have some time. here are kind of some of the key takeaways for tonight that I hope you can take with you. Given that sleep, right, it is this habitual process. We've talked a little bit about that. That's why I refer to it as sleep hygiene. It's a habitual thing. We get into this lifestyle phase, like we get into this habit. What we want to see is like the earliest intervention for sleep that we can. The earlier that you intervene and the earlier you set some of these things up, like I know we had somebody who talked about having a 3-year-old, that might have been the youngest one that I saw. If you set this stuff up, the earlier you do it, the better. It does have important effects. It does lay the foundation for future sleep. And so the earliest you can do it, do it. You're so welcome. Thank you guys for coming. We had some people saying they had to leave. So yeah, start early, start as early as you can. It's never too late to start. Start now if you can. Like I said, if you have older kids, giving them this information and kind of going over some of the points with them might be really helpful. Yeah, before you leave, try to take our survey. We want to make sure we're giving good information. Systemic changes, like the stuff that we talk about at like later school times, limits on homework loads, this stuff can definitely impact sleep duration and subsequently academic performance. So we want parents to like advocate for their kids. We want the school district and, other people to advocate for these systemic changes because this stuff really does help. And there is scientific evidence to support it. Parents have a role to play in healthy sleep, even in high school. We want you to set appropriate like boundaries and bedtimes. And I want you to help get screens out of kids' rooms at night. I have a couple of suggestions for that here on the last point, and I'll kind of hit that one now. It's tech companies need to be a part of the solution, right? If we have anybody that works in the tech industry or people that have connections, like we want them to enable nighttime turnoffs, right? So that adolescents, kids that are using these social media platforms under a certain age, we want them to enable nighttime turnoffs so that they get the sleep that they need. In lieu of having the school district change things, or there's those big systemic changes or these like tech companies changing things, because not all of us are able to make those changes or even advocate on a meaningful level. I will say all advocacy is meaningful, but maybe you don't feel like it is if you don't have any of those connections. But like in lieu of this, get a Wi-Fi timer. They sell them on Amazon. They sell them during Christmas season. You might even have one in like your Christmas box. Plug the timer in and then plug the Wi-Fi into the timer. It will turn off the power to the plug at a certain time. If you implement something like that where the Wi-Fi turns off at 8, then the whole household's not using Wi-Fi, right? There's no like, oh, well, you get to use it. You're modeling really good behavior. You're turning it off. You still would have that cell connection on your phone, right? If you really needed an emergency call, or if you're worried about that, or if you have work engagements or things like that, that you require cell service. But like, turn the Wi-Fi off at night. Unplug it even, take the cords, get creative if you have to. Create a tech box in the parents' room. You can use that to charge your devices. Everybody can throw everything in there and you power everything off and charge everything. And then in the morning, everyone can come get their device, right? Like I said, finding some sort of timer, setting limits on the apps, whatever you need to do as a parent to gain control of the situation and be a part of the solution. That is one of my key, hopefully key takeaways for you guys as parents. And my last little takeaway is that adolescents should absolutely be part of the solution. They need the information. They need it to make informed choices. We can't just expect them to like know this or be able to make these decisions on their own. We really want to give them all the information and help them, especially older kids, be a part of the solution and make that change for themselves. So those are my key takeaways. I've got lots of people thanking us in the chat. You're so welcome. I'm so glad that there was a lot of helpful information. If you could fill out the survey for us, you just have to scroll up a little bit. You can click it. Our next session is April 10th. The topic is anxiety in kids, anxiety or worry in kids. And so, yeah, we've got the survey in there. I don't have anything else. Annie, if you don't, or if anybody has questions, today was so great. I'm so amazed that you parents are willing to take time out of your day, and it's effort, and I appreciate it. I welcome you guys to the next one.